Influenza, the flu vaccine, is actually very important to get. And why? Because that can be a lifesaver. Especially when we are as young, after 65 years old, the flu can kill. It's lethal. There are a lot of people that they say, I will not get the flu shot because I never have been sick with the flu. So let me tell you, all that we get, weaker that we get, our immune system weaker that it get, and we can finish. The difference between having a cold and having the flu is that the flu can kill you. A cold, you can have a Tylenol, aspirin, and gone, and you're good. But if you have the bad luck to get the flu and not get immunized, that can take you into the hospital with a pneumonia. And when we are, after a certain age having pneumonia, we know that after the age of 65, a pneumonia is a high risk for death. So that is why I want to talk about, all of these things. This year, by the CDC is an organization that every year release what is the prognosis for the influenza. And the CDC this year is telling us that about this month, the next month, February, gonna be the peak of the incident of this influenza virus. So we haven't seen, and actually the prognosis is like one of the worst season for the flu. So you guys be prepared. One of the ways that we can prevent the flu, not only with the influenza vaccine, definitely that will protect you, and unfortunately it's only protect you like about 60%. That is why some people, even though that they got the flu vaccine, they can develop the flu, because there are some types, there are different types of flu. So a vaccine only can protect you to a certain amount of type of influenza. Do you have a question?
No.
Okay, no.
I'm just thinking.
You're thinking. So if you are, let's say that the vaccine protects you about 60% of the most common influenza virus, you have a 60% less to be super sick or finish in the hospital. It's better to have been protected 60% than zero. So this is something that I talk to all my patients, because most of the time patients they think, and you probably heard from somebody else, like I will not get the flu vaccine because I get sick anyway. Or I got the flu vaccine and I got sick. When in reality, that is not the reason. You get sick because you will get sick. You will get the cold. You're still getting the cold, but not the influenza. There are two different types of virus during the winter season. How early can you get the influenza vaccine? At the end of August. Almost at the end of the summer.
How long does it last?
It will last the entire year.
I got it in November, and that's a long time ago.
Okay, no, that's good. You get the influenza vaccine in November, you are protected until November next year. So let me give you a little bit of history how this protection works and why it has to be every year. Influenza is a virus that actually starts, the influenza season starts in the winter in the Asian countries. So what happens when we take a plane, when we travel, we start to move those viruses from the Asian country all around the world. That is why you have to have the influenza vaccine covered for the entire year. Let's say the influenza start to move around the world, and usually the winter season in United States, that is far away from maybe some of the Asian country, that is when the virus say, the weather is perfect, let's multiply faster. So that means that you can have the flu anytime through the year. But the winter is the cold temperature.